Welcome to This Explainer. Today, we're diving into the fascinating and, honestly, highly complex world behind invisible braces. Clear aligner therapy has completely skyrocketed, right? It's gone from this niche cosmetic option to a massive pillar of modern orthodontics. Patients are literally walking into clinics asking for them by name. But here's the real question. How do dentists actually build the clinical confidence to use them safely and effectively? Well, that's exactly what we're unpacking today as we trace the ClearPath certification journey. To kick things off, we kind of have to shatter the illusion of simplicity, because there's a huge contrast in perspective here. When patients look at a clear aligner, they just see this simple, invisible, plug-and-play plastic tray. But the doctor's reality, totally different. They're managing a highly sophisticated orthodontic force system. It's a treatment that heavily depends on precise calculations and, frankly, strict patient compliance. And bridging that gap between a piece of plastic and clinical reality, well, that's exactly what proper training is all about. Here's the roadmap for our explainer today. We'll start with a clear aligner reality, look at what certification actually means, walk through the 6 steps to success, master the digital workflow, and finally, wrap up with how this elevates a dental practice. Section 1, the clear aligner reality. Because offering clear aligners successfully takes far more than just having access to the product. Before you can even think about incorporating aligners into a practice, you really have to understand exactly how they work. And at the core of this is clear aligner biomechanics. Because let's be real, aligners don't just magically shift teeth. They move them through carefully staged, sequenced force systems. A doctor absolutely needs to understand how forces are expressed, which movements are actually predictable, and why staging matters so much. This is that crucial moment where clear aligner treatment transitions from abstract theory into true clinical reasoning. It's all about structured treatment planning, not just trial and error. Section 2, what certification actually means. Let's explore exactly how the ClearPath Institute bridges this massive knowledge gap for clinicians. So when we talk about certification, we're talking about learning from a proven authority, over 300,000 treated cases. That massive number represents the global footprint of ClearPath Orthodontics. Founded back in 2007, they bring over 17 years of experience and a network of more than 10,000 certified dentists to the table. When a doctor gets certified through ClearPath, they aren't just reading a manual. They're tapping into a clinician-led educational platform, one that's designed to build practical, grounded skills based on hundreds of thousands of real-world outcomes. The educational philosophy at the ClearPath Institute is simple, but it is incredibly powerful. Theory and practice absolutely belong together. You can't just read about this stuff. While you need that vital theoretical knowledge like biomechanics and digital planning, it has to be paired with physical application. We're talking intraoral scanning, attachment placement, and interproximal reduction. By putting theory and hands-on practice in the exact same room, doctors develop a crystal clear mental model of how treatment works, from the very first records all the way to the final retention phase. Section 3, 6 steps to success. Now we're going to look at the exact pathway a doctor, specifically one in Pakistan, takes to become a ClearPath Certified Provider. This straightforward 6-step journey ensures doctors don't just, figure things out on the fly. It is a safe, guided, and highly structured progression. Step 1 sets the foundation, literally knowing what aligners can and cannot treat. Step 2 moves into those biomechanics we talked about. Step 3 is all about case selection. Step 4 transitions into digital planning. Step 5, that's where the hands-on practice happens, under expert supervision. And finally, Step 6 is applying this safely in the clinic, typically starting with moderate cases. This structure ensures doctors are learning in a supportive environment rather than by trial and error on live patients. Now, I really want to highlight Step 3 here because this concept is absolutely critical. Case selection is arguably the single biggest determinant of a smooth aligner case. Clear aligners are fantastic for things like crowding, spacing, or deep bites, but they just aren't the perfect tool for complex skeletal problems. A trained provider has to be able to look at a patient's records, recognize when aligners are not the right fit, and honestly explain why. Knowing exactly when to say no not only protects the patient, but it builds tremendous trust in the doctor's practice. Moving into the hands-on phases, like Step 5, doctors tackle highly specific clinical techniques, like interproximal reduction, or IPR for short. Basically, this is the clinical technique of safely creating tiny amounts of space between teeth to allow for movement, and it requires precise assessment and instrumentation. Mastering hands-on techniques like IPR and attachment placement in a supervised setting is exactly where most doctors report their biggest leap in clinical confidence. It literally turns an intimidating concept into a repeatable, comfortable skill. Section 4. Mastering the digital workflow. Now that those clinical foundations are set, let's see how modern aligner treatment relies heavily on cutting-edge technology. Real-world feedback from dentists highlights exactly how this digital workflow revolutionizes a practice. For instance, Dr. Momina Sindasieta noted how CP Smart 2.0 simplifies treatment planning, making case submissions and progress tracking incredibly smooth through the dentist portal. Tools like this completely streamline the aligner process, taking it from a physical, analog headache to a sleek digital pipeline. And what's really amazing is that the manufacturing behind this operates on a 48-hour turnaround with 50-micron precision. Basically, clean data going into the digital portal means a fast, flawless pipeline coming out. But the crucial point here is all about control. Approving a plan should be an informed decision, never a formality. Even with these amazing digital simulations and platforms, the doctor reviews every single virtual setup. They evaluate the proposed tooth movements stage by stage, and they communicate any needed revisions before a single aligner is ever manufactured. The technology is incredibly advanced, sure, but it is always entirely subservient to the doctor's clinical judgment. Section 5. Elevating your dental practice. We've seen the education, the clinical steps, and the tech, but how does this ultimately reward the practitioner and the patient? Well, a rapid-fire pre-treatment checklist visually demonstrates just how comprehensive a certified doctor's approach has to be. Before a patient ever puts on their very first aligner, a doctor has secured a confirmed diagnosis, high-quality digital scans, and a fiercely honest suitability assessment. They've planned exactly where attachments go, calculated every single millimeter of IPR, and had a serious conversation with the patient about compliance and wear time. This level of discipline, it means fewer avoidable complications, fewer refinements, and ultimately a much smoother experience for everyone involved. Looking at the bigger picture, we really need to stay grounded in an important professional reality. Certification through ClearPath is a powerful tool for professional development, but it is absolutely not a license that replaces a dentist's core qualification or clinical judgment. The treating doctor always remains entirely responsible for the diagnosis and the patient's overall care. In Pakistan, this means operating strictly within PMDC regulations, starting out with straightforward cases, and safely expanding their orthodontic services only as their hands-on experience grows. Which brings us to a provocative question I want to leave you with today. If clear aligners are simply a plug-and-play tool, who is really designing your smile? The truth is, there are no unsupervised mail-order magic tricks here. Behind every single successful, predictable clear aligner case is the vital, irreplaceable clinical judgment of a highly trained professional. To discover more about this educational journey and how doctors are transforming smiles safely and effectively, you can learn more at clearpathortho.com. Thanks for joining me for this explainer, and keep learning.